Hello guys, I'm Deepak Shukla. Welcome to our channel Study Mania. Today let's learn about some inflammatory conditions of larynx. So first we'll have acute epiglottitis, that is inflammation of epiglottis, mainly supraglottis, and acute laryngotracheobronchitis, that is also known as CROUP, means inflammation of larynx, trachea and bronchus. Let's see each one separately. Coming to acute epiglottitis. So it is the inflammation of supraglottis, okay, that is epiglottis, epiglottic fold and arytenoids. The causative organism Streptococcus pneumonia, okay, and H influenza. It is now less common H influenza because of vaccination. Age group is very important. 3 to 6 years of ages, like where you'll see acute epiglottitis, okay. It have rapid progression and sudden onset. Now coming to the symptoms, since infected by the bacteria, that is Streptococcus pneumonia or Haemophilus influenzae, the symptoms are malaise, fever, that is of high grade, and child looks toxic. Okay, so we have three features like respiratory symptoms, GI symptoms, and phonatory symptoms. In respiration, they have inspiratory stridor. Okay, because epiglottis has been infected, so it has become thickened. Okay, so there is only inspiratory stridor. Okay, in GI, since epiglottis or supraglottis involved, arytenoid folds is involved, so they have dysphagia, odynophagia like painful swallowing, and drooling of saliva, since base of tongue is also involved. Okay, in phonatory symptoms, there is no voice change and no cough because vocal cord is not involved. Okay, so these was about the symptoms of the epiglottitis. Coming to the other half, that is CROUP or acute laryngotracheobronchitis. It is the inflammation of larynx, trachea and bronchus. Here it is caused by parainfluenza type 1 and type 2. It has slow onset and can progress to obstruction slowly. Age is from 3 months to 3 years. Okay, here it was 3 years to 6 years. Here it is 3 months to 3 years. Here you have low grade or no fever. Child is not looking toxic. There is biphasic stridor. Biphasic stridor because bronchus is also involved, trachea is also involved. Okay, there is no GI symptoms as such, and even if it is present, it is very mild. Voice change and cough is present. Okay, voice change and cough is present. Barking seal like cough is characteristic of CROUP. Okay, why? Because of the involvement of vocal cord. So these were the symptoms and findings of acute epiglottitis and CROUP. Now coming to the management. See, examinations should be avoided in both cases as they may increase the chances of laryngeal edema, okay, because of the inflammation. So how to do the treatment? See, antibiotics can be given in both conditions. In CROUP, because to prevent the superadded infections, okay, and in epiglottitis we have to give that. Steroids can also be given in both the cases to reduce the airway edema. Analgesics have to be given in both the cases. Okay, voice rest will not help in epiglottitis because vocal cord has, like, it's not involved, but it will be helpful in CROUP. Cough suppressant, since vocal cord involvement is there in CROUP, so there is, therefore cough suppressant is helpful in CROUP but not that much in epiglottitis. Rhythmic adrenaline nebulization, that can be given in both cases because that will cause vasoconstriction and reduces the bronchial edema, means it causes bronchodilation. Bronchodilators can be given in the CROUP. Hydration is very important. Okay, and intubation and tracheostomy is done in emergency conditions in both cases. Okay, wherever you find there is very difficulty in breathing. So X-ray findings, what you'll see in epiglottitis, the epiglottis will be swollen and there will be thumb-like sign, swollen epiglottitis in the lateral view of the X-ray. Whereas in CROUP, you'll find steeple sign in AP view, means constricted airway looks like steeple of the church. So this was about the X-ray finding. In epiglottitis, child will sit in tripod position, so to improve breathing. So this was about the epiglottitis and CROUP. Thank you so much.